The clavicle. It is also known as the collarbone. The clavicle, it is the Latin word which means key. It is located between the sternum and the scapula, and it is the one only bone, a long bone that is placed horizontally across the root of the neck. The clavicle, you can see here, the clavicle is a long bone and it is the horizontally placed. You can see it is the clavicle and it is horizontally placed, and here is the scapula, and this is the humerus, and this is the sternum, and this one upper is the sword shaped like structure is known as the manubrium. Okay, the medial end of the medial end of the clavicle articulates with the manubrium. This is the manubrium articulates with its clavicle and forms a sternoclavicular joint, because manubrium is also the part of the sternum, so it is the sternoclavicular joint. Okay, come on the lateral end. This is the lateral end which has the scapula, and here will be the humerus. So the lateral end of the clavicle articulates with the acromion of the scapula. Acromion is the process present in the scapula, and it forms acromioclavicular joint. Means the acromion process of the scapula and the clavicular joint, and clavicle and the lateral part of the clavicle form acromioclavicular joint. Okay, the clavicle is divided into third along its path, means get divided into three parts. The lateral part, which is known as the lateral, means the third part, and this is the mid part, and the last one is the medial part, which articulates with the sternum, yani ke manubrium. And the clavicle is curved convex forwards at its medial, and the clavicle is concave forward at its lateral end. The clavicle are a number of impression on the undersurface, and the area gives attachment to the trapezoid. This area, which is shown in a pink color, this gives attachment to the trapezoid ligament, and this is known as the clinoid tubercle, and it gives attachment to the clinoid ligament. This is what is clinoid ligament. This is one of the coracoclavicular ligament that stabilizes the acromioclavicular joint. Which is the acromioclavicular joint? Which is formed by the acromial process of the scapula and the lateral end of the clavicle. This joint is known as acromioclavicular joint. Okay, this area, which is known as the costoclavicular area, this area gives attachment to the costoclavicular ligament that arise from the first costal cartilage. First costal cartilage यानी कि first rib, and first rib for the costoclavicular ligament. And what is the function? It stabilizes the sternoclavicular joint. Sternoclavicular means के manubrium and the clavicle and the medial end of the clavicle. Okay, the sternoclavicular joint. So this is the costoclavicular ligament, and these are the anterior, and this is the manubrium, and this is the further. It forms the sternoclavicular joint. Okay, now muscles that attach to the clavicle. The muscles that are attached to the clavicle, first muscle is the deltoid muscle, which is attached to here. This is the posterior part of the clavicle, and this is the anterior part of the clavicle. This is the lateral part which forms sternoclavicular joint, and this is the medial part which forms acromioclavicular joint. Muscle that attached to the clavicle, this is the deltoid muscle, and attached to the anterior part of the clavicle. And this is the undersurface. Always remember, this is the undersurface. Okay, another muscle attached here. This is known as the pectoralis muscle, attached to the clavicle, and it is also to the anterior part of the clavicle. Okay, this is the subclavius muscle, another muscle attached to the clavicle, and the another muscle which is attached to here is the trapezius. It is to the posterior, and this is the stenoid muscle that are attached to the clavicle. So these are the muscles are completely here. So I gave you the summary of the muscles that are attached to the clavicle. This is the deltoid, pectoralis major, subclavius, stenoid, sternocleidomastoid, and the last one is trapezius. So okay, come here. Lateral chest wall. The lateral chest wall, deltoid, origin lower third of the clavicle in the acromion spine of the scapula. Insertion deltoid tuberosity on lateral shaft of the humerus, which is a long bone present on the upper limb part. And the action, it is flexus arm, internally rotate arm, and middle abducts arm, and posteriorly externally rotates arm. And must remember always nerve supply. What is the nerve supply of deltoid muscle? Is the axillary nerve. If axillary nerve damage, deltoid muscle will damage, and deltoid muscle will not work properly, or we loss of sensation, so it cannot provide these actions which are present above. And blood supply, deltoid branch of thoracoacromial artery. So okay, next is the pectoralis major. Its origin is clavicular head, and insertion is the lateral lip of bicipital groove of femur, which is present medially and anteriorly. And the action of the pectoralis major is the flex and adducts arm. And if we two heads of pectoralis major, one is the clavicular and the other is the sternal head. But remember this character, it involves in flex and adducts arm. Flex and adducts arm, and also remember this, that it internally rotates the arm. And the nerve supply, which is very important, is the lateral and medial pectoral nerve, and these are the root values of the medial lateral pectoral nerves: 5, C5, C6, C7, C8 and C1, T1 sorry. And the blood supply, pectoral branch of thoracoacromial trunk. Okay, come to the another one, which is the trapezius. So origin, medial third of superior nuchal loin and axonal bicipital tubercle, prototuberculum, and insertion is the lateral third of the clavicle, acromion spine of the clavicle. And the man is the action, it provide detect and depress scapula. And nerve supply is, which is very important, accessory nerve or cervical nerve. It is important in exam point of view or in viva point of view about trapezius, because trapezius is nerve, because the nerve supply of trapezius is cervical nerve, and the root value of cervical nerve is C3 and C4. And the blood supply, we always remember, transverse cervical artery. Okay, thank you guys.